Welcome back, everyone. Okay, so this video, sorry, I play with my hair, I'm a fidgeter. This video is going to talk about kind of what Brandon and I have tried in terms of trying to have a family, and what we've discovered from our doctors along the way. So Brandon and I got married in November of 2010. We got married on his 2 weeks of a deployment, like his 2-week vacation from a deployment. So we didn't start our journey till a little bit later because we didn't even start living together until a year into our marriage due to him being deployed. So Brandon was in the military for 14 years and he deployed to Iraq, Afghanistan, and Kuwait. He's also been to Korea. So we were not together during Iraq. We got together during Afghanistan. So we were together during Afghanistan, Kuwait, and Korea. So we started our journey almost immediately because of my age. I was getting to be about almost 30. And so we wanted to kind of start. And after 4 years of not being successful, 3-4 years, we started seeing a fertility doctor to get assistance. So some of the things that we did was we tried Clomid, which is a pill that the woman takes, a hormone pill, and it's supposed to help them kind of ovulate more. We did that for about 7 months, and that was not successful. So then we moved on to the next step, which is an IUI. So an IUI is when the guy does his business in a cup and the doctor puts it into a syringe type situation. The woman takes the fertility pills like Clomid again. And then when she is ovulating, they give her a trigger shot to force that egg to come out. And on that day, they inject the woman with the sperm to kind of, and they place the sperm directly into the uterus so it doesn't have to swim. The military only covers the medication and the tests, but not the procedure itself. We did 3 cycles of that, and each of those cycles were $500. Hello, infertility. So we spent a total of $1,500 on that, and all 3 were unsuccessful. But during that process, so we stopped for a little bit, then we started back up at another military base, and this is when we really started getting answers. Because of my history, they set us up with the head of the department again. So he's in charge of everybody. It's not just a normal doctor. During this time, before we started, I was being treated for pre-cervical cancer. So I had a steroid version of chemo. I had a LEAP procedure, which is basically where they scrape the inside of my cervix and make it thinner, and they nipped the tip and cut it shorter, which again causes lots of issues when it comes to getting pregnant, trying to get pregnant. So when we started doing the tests, they told me my tubes were still good, that I actually had a lot of eggs, very fertile, that there was no issues. Well, then they started doing tests on Brandon, and it turns out that he has a low sperm count and they're not very mobile. So they're not very good swimmers. And when the doctor started looking into the reasoning, it was very common for soldiers who were deployed to a specific region in the Middle East. There was a chemical that they were exposed to that basically made them sterile. So no matter what we did, the only way that we would be he basically said, with this knowledge, the only way we would be able to get pregnant would be if we were to do IVF, which they fertilize and then inject the egg, which can be like $20,000, not guaranteed to work. So we were like, okay, well, maybe we'll do that. But they had to run all these other tests because they couldn't figure out, once I was pregnant, what was going on that made me lose all my babies. So as they were doing these tests, they realized a lot about me. I lack the enzyme to break down folic acid, which is needed for the baby. So I would have to go on special pills, vitamin B pills, and some other pill to help with that. I couldn't break down iron, which again is very needed. So I'd have to not only take iron supplements, I would have to take a pill to help break down the iron. I created a blood clotting disorder only through pregnancy. So I would have to take a baby aspirin every day, plus do heparin shots, which hurt and sting. And because of the LEAP procedure, I would have to get my cervix stitched. Because if I didn't, it wasn't a matter of if I was going into preterm labor, it was a matter of when I was going into labor. And because of that, I would pretty much be bed rested the whole second half of my pregnancy. And because of my history with the ectopic and everything and the miscarriages, I would have to see a doctor 3 times a week my whole pregnancy. So with all of this information, the doctor pretty much said, don't get pregnant. Because even if I was successful, there was so many hoops and so many factors that were going against us. Even if I was to get pregnant with IVF, I wouldn't be able to carry it. Basically, my life would be hell. So his advice was that I just didn't do it. So we started living like we're just not gonna have kids. Then it started really getting to us in about 2019, 2020, that we really, really wanted a family. So we started the adoption process, but then COVID hit, and that made it impossible to do the home study and everything else that was required, like the traveling for the orientations. So ultimately we had to back out because of COVID. Thank you, COVID. So then again, we got situated in a situation where we're like, okay, we're content. We're just not going to have kids. But then the holiday season came, and I attended an event for families who have lost children with my dad's choir, and it really hit me and made me really feel that hole in my heart that I have, because I've always wanted to have kids, always. And so I talked to Brandon and we prayed about it, and we decided to do it again. For those who don't know, I am adopted, so I am not against adoption. Last year in 2021, right before Thanksgiving, literally the day before, after 8 years of looking, I found my biological mom and found out that I had siblings. So adoption was never a, no, we're not going to do it. You know, it was never a, well, I will only do it if it's our kid. No, that was never a thing. So yeah, so that's what got us to the point of where we are. So in my next video, I'm going to talk about the first steps, the agency we picked. I may not say their name specifically, but I'll talk about the first step that we've taken and update you on what's happened so far. See you then. Bye.